You wake up, you swing your legs over the side of the bed, and as your feet touch the floor, there it is again. Stiffness in your knees. It takes a few steps to even feel like you're walking normally. If that sounds familiar, you're not alone. Millions of older adults experience morning knee stiffness. But here's the truth most people don't realize. Stiffness isn't just a sign of getting older. It's your body trying to tell you something. And the good news? With the right approach, you can regain comfort, flexibility, and strength in your knees, naturally, and often without medication. Why knees stiffen with age? Let's talk about what's really going on inside your knees. Your knees are hinge joints. They carry your body weight, absorb impact, and support every step you take. Inside, they're made up of cartilage, ligaments, synovial fluid, and bone. When everything's working well, your knees move smoothly and painlessly. But over time, things begin to change. Cartilage wears down. The fluid that lubricates your joints, synovial fluid, starts to dry up. Inflammation creeps in, especially during the night when your joints are inactive. And the result? You wake up with stiffness, tightness, maybe even pain. It's not just about age, it's about movement, or more accurately, the lack of it. During the night, when your body is still for hours, your joints don't circulate fluid well. Inflammation builds up. Muscles around your knees tighten. So when you get up, everything feels stuck. Research from the Arthritis Foundation shows that the first 30 minutes after waking is when joint stiffness tends to peak, especially in people over 60. And if you've had a sedentary day before, the stiffness will likely be worse. What not to do? Now here's where many people go wrong. They think, well, I'm just getting older. I guess this is normal. So they do less, walk less, move less. But this actually makes the problem worse. Avoiding movement reduces circulation to your joints. It weakens the muscles that support your knees, especially your quadriceps and hamstrings. And without that muscular support, more pressure falls on the joint itself, speeding up wear and tear. Even worse, many people resort to painkillers as a long-term solution. While these may give temporary relief, they don't fix the root cause, and long-term use can damage your gut, your kidneys, and even your heart. So if avoiding movement and relying on pills isn't the answer, what is? The natural fix. Move, nourish, repair. The solution lies in a three-part approach. Move your joints, nourish your cartilage, and repair inflammation. First, movement. But not just any movement. Smart movement. Gentle, low-impact exercises that wake up your knees in the morning can make a huge difference. Try this. Before you even get out of bed, gently bend and extend your knees 5 times. Then, as you sit on the edge of the bed, slowly lift one leg at a time for a seated leg extension. This stimulates blood flow and warms up your joints before you start your day. Next, nourishing your cartilage. Your joints rely on nutrients like collagen, vitamin C, and omega-3 fatty acids. Bone broth, salmon, and berries are excellent. Even better, adding collagen peptides to your morning routine can help restore the cushion in your knees. A 2018 study in Nutrients found that older adults who took collagen daily saw improvements in joint comfort and mobility within 12 weeks. And finally, reduce inflammation. Chronic low-grade inflammation is one of the most overlooked drivers of knee stiffness. It slows down healing and breaks down cartilage. Natural anti-inflammatories like turmeric, ginger, and green tea can help. But what's more powerful is reducing inflammatory foods, ultra-processed snacks, excess sugar, and refined oils. Don't underestimate the impact of diet. What you eat daily either feeds your inflammation or fights it. The role of muscle strength. Now, let's talk about something many seniors overlook. Muscle strength. Strong muscles around your knees act like natural shock absorbers. They take the load off the joint itself, allowing it to rest and recover. But here's the catch. After the age of 50, your body loses about 1 to 2% of muscle mass every year if you don't actively work to preserve it. That's called sarcopenia, and it directly impacts your knees. Even simple strength exercises can rebuild this lost muscle. Wall sits, mini squats using a chair, or leg raises done daily for a few minutes can help restore that muscular cushion. Over time, you'll notice less stiffness, better balance, and more control when walking or climbing stairs. Small daily choices, big results. What I want you to take away from this is simple. You don't need a fancy gym, a complex routine, or an expensive supplement stack. You need consistent, small actions, done daily. Start your mornings with gentle movement. Add collagen and omega-rich foods to your breakfast. Choose anti-inflammatory meals over processed ones, and set aside 5 minutes a day for leg strengthening moves. That's it. Over time, you'll notice something remarkable. You're not dreading that first step out of bed. Your knees feel more fluid, more stable, and most importantly, you regain confidence in your own body again. Because it's not just about knees. It's about your freedom to move, live, and enjoy every day without holding back.